If you have an intubated baby who suddenly decompensates, you should really think about, hey, it's Amanda. I'm a neonatal clinical nurse specialist, been a NICU nurse for 16 years. Today, I have a very busy day full of teaching, which is one of my favorite things to do, but I have a lot of favorite things. This morning, I'm teaching the PALS class in my NICU. We're a level 4 NICU, and we're in a huge delivery room hospital. So our nurses do both NRP and PALS. Let me know what you do in the comments. Like, do you guys do NRP only, PALS only, or both? We do both. So today, I really enjoy teaching PALS. PALS has so many great concepts to know, one of which is the dope mnemonic. And that I think it's so high yield. I think it's so helpful to know at the bedside at any time when you're taking care of patients, especially an intubated patient. So if you have an intubated patient who suddenly decompensates, their heart rate drops, their sats drop, they're looking crappy, you're not sure what's going on, one of the things you can think about is DOPE. So D stands for displacement. Is the ET tube in its right place? Did it get displaced either unplanned extubation, it came out, or did it go in too deep? Did it get displaced down into the right main stem? Which can happen, right? If the tape isn't secure or something happens, it can move, especially with our little babies, right? There's not a lot of wiggle room. So D is displacement. O is obstruction. So is it obstructed? Is there secretions that are blocking it? If it's a really small baby, is it kinked somewhere? All of that, of course, if the airway is obstructed, then the baby is going to start to brady, start to desat, and not start to look good. So D-O, and then P, you can think about pneumothorax. When you're looking at the baby's chest or listening, do you hear bilateral breath sounds? If you have a transilluminator on you, you can do that quick screen for that illumination that can happen if there is an air leak or a pneumothorax. So DOPE, displacement, obstruction, pneumo, and then E, what's E? When I first took PALS, some of the very first times, I thought that this probably never happens. But obviously it does, otherwise it wouldn't be in the mnemonic. E is equipment failure. So is the equipment still working? Did something happen? Is the vent always plugged into the outlet that's connected to the generators for your hospital? Sometimes equipment fails, and so you have to be mindful of that. So that is one of my favorite of many things that I love about the PALS algorithm, or one of the PALS mnemonics. But like I said, let me know if you take NRP or you do PALS or do you do both, and follow me for more NICU education.